Some of the top supplements I've seen for allergies are a class of supplements called mast cell stabilizers, which basically means that rather than what we typically think of as allergy medications, like when we think of Allegra, Zyrtec, Claritin, Benadryl, things like that, the histamine that your cells are producing have already been released into the system. These drugs are coming in and binding up histamine receptors so that the histamine that's floating around the system can't bind. Once that happens, you're not going to have allergy symptoms. So they're working very well for any kind of an acute allergic reaction. But for long-term allergy care, it's a little bit less useful to constantly be binding those receptors over and over, because just like with anything else, you start to get some desensitization. Your body starts to get used to it a little bit more. Mast cell stabilizers, on the other hand, make it so that your cells don't release that histamine as readily in the first place. Kind of anger management for your cells and their histamine release. They are less acute acting, so it's a little bit more effective after about 4 to 6 weeks of use. And then it's something you can just do on a daily basis. And it's basically, a lot of different companies make the same kind of product. Vital Nutrients has one called Allergy, Orthomolecular Products has one called D-Hist, Apex Energetics has one called Histo-X, Research Nutritionals has one. A lot of companies do a similar kind of idea, but in general, they all have quercetin, nettles, bromelain, vitamin C, butterbur. These are some of the common things you'll see in all of these formulas, which are all there to stabilize those mast cells and not allow for that histamine to be released as readily.